Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, then try to take actions to make a better system for all of us. Today we're going to be talking about Project 2025 and how it affects healthcare, especially women's healthcare. Before we do, I want to point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's video. It has all of the backup material, all of the references, all of the actions, everything we mention is in there. In fact, even at the bottom of the newsletter, you'll find lots of important references for healthcare organizations and contacts you may need in the future. Anyway, let's get started. Before we go too far, I want to say that my wife and I grew up as software people building radars. So when I find software in medicine, I'm always intrigued. A new computer algorithm now has achieved a 98% accuracy in predicting different diseases by analyzing the color of the human tongue. The imaging system was developed by Iraqi and Australian researchers, and it can diagnose diabetes, stroke, anemia, asthma, liver and gallbladder conditions, COVID-19, and a range of vascular and gastrointestinal issues. Engineering researchers from the Middle Technology University and the University of South Australia achieved the breakthrough in a series of experiments where they used 5,260 images to train the machine learning algorithms to detect tongue color. This is so cool. Two leading hospitals in the Middle East supplied 60 tongue images from patients with various health conditions. The artificial intelligence model was able to match the tongue color with the disease in almost every instance. A new paper has been published in Technologies, and it outlines how the proposed system analyzes tongue color to provide on-the-spot diagnoses, confirming that AI holds the key to many advances in medicine. This was actually reported at the University of South Australia, and there's a link to their report in the newsletter. I know this is an unusual application of machine learning, but it holds great promise to help people who live in remote locations. Okay, let's talk a little bit about bird flu and raw milk. We've done this one before. There are a number of right-wing, I don't want to cast aspersions, but they're nuts. They're promoting that people drink raw milk and that they view that government insisting on pasteurizing milk is government overstepping their bounds. Let's be frank about it. That's BS. Anyway, bird flu, H5N1, passes to cows and thus to milk. The birds leave it out in the fields, the cows ingest it, it winds up in the milk. There have been dairy workers around the country who've become infected. Now, if you drink raw, unpasteurized milk, pasteurization is heating to kill all kinds of germs you don't want. You can become exposed to bird flu if you drink the raw milk, which is unheated. No matter what any right-wing can't tell me what to do talking head says, my advice to you, don't drink raw milk. Okay, it is now reported that 1 in 6 dairy products in the U.S. retail stores contain signs of inactive bird flu virus this summer. Regulators said slightly lower than the numbers seen in a different survey when the pathogen was first found in the nation's dairy herds. None of the 167 samples, which included milk, ice cream, hard cheese, butter, cream cheese, and aged raw milk cheese, contained viable H5N1 bird flu, because guess what? They eventually had been pasteurized. The US FDA said, so we're getting it from them, they're testing it. Milk that's been pasteurized, safe to use. The results show that pasteurized dairy remains safe to consume. This is out of Bloomberg News, and of course there's a link to their story. So don't drink raw milk. Let's talk about abortion on the ballot. Abortion will be on Missouri's statewide ballot in November, an initiative petition to enshrine the right to abortion up to the point of fetal viability which is actually the right answer, received final approval this past week, Tuesday, securing a place on the general election ballot Tuesday, November 5th. If the measure receives a majority of votes, Missouri could become the first state to overturn an abortion ban through a citizen-led measure. Excuse me, abortion is illegal in Missouri, with limited exceptions, only in cases of medical emergencies. We've already seen that that's sort of a hoax. There are no exceptions for survivors of rape or incest. Isn't that charming? If the amendment receives more than 50% of the votes in approval, the measure would legalize abortion up to the point of viability, and an undefined period of time, generally seen as about the point in which the fetus can survive outside the womb on its own. Generally, it's around 24 weeks or so. Of course, it varies. This is all according to the American College of Obstetricians and Gynecologists. There's a news story from the Missouri Independent. I've put in a link for you for that in the newsletter. So, which states have a ballot referendum related to abortion this fall? It's not a small number. Arizona, Colorado, Florida, Maryland, Missouri, Nevada. New York has one that's discrimination related. South Dakota. Still to be decided for the November election are Montana and Nebraska. But actually, that was a trick question. Because guess what? Abortion is on the ballot in every state. You should vote accordingly. Okay, let's talk briefly about Project 2025 and reproductive rights. Project 2025, the Heritage Foundation's plan for the next Trump administration, God help us if there is one, calls for mass data collection on abortions using every available tool, including the cutting of funds, to ensure that every state reports exactly how many abortions take place within its borders, at what gestational age of the child, fetus, you're supposed to say fetus, for what reason the mothers had for having an abortion, and the mother's state of residence, and what was the method used. How invasive is this? You know, for people that say they want limited government, this is government overreach by a landslide. Anyway, with contraception, the plan proposes requiring coverage of natural family planning methods. Big deep breath. And removing requirements that insurance covers certain emergency contraception. It also calls for reviving Trump-era rules, giving employers religious and moral exemptions from covering the cost of birth control that was changed under the Biden administration. The plan also says that the Department of Health and Human Services should be able to defund Medicaid approval of Planned Parenthood despite the health center providing several services way outside of abortion care, like all kinds of sexual health and just general health for people that don't have funds to get to a doctor. The right to contraception in the United States was first recognized by the Supreme Court in 1965. Did you hear me? The right to contraception, because before that, there was no right. The case was called Griswold versus Connecticut. It was a 7-2 ruling. It overturned a Connecticut law that criminalized the use of contraception. Are you hearing this? Finding that it violated the right to marital privacy. However, some states continued to prohibit contraception for single people after the ruling. In 1972, the Supreme Court extended the right to privacy to single people in the case of Eisenstadt versus Baird. In his concurring Dobbs opinion, striking down the right to abortion care in the U.S., Justice Clarence Thomas, my favorite, said that the Supreme Court should reconsider its past rulings codifying the right to contraception, access, and same-sex relationships and same-sex marriage. That guy is just beyond the pale. Talk about going back to the good old days, like not at all. Make contraception illegal again. That's their plan. Look, we need to take action and let our representatives know this don't hold water and we don't want it. You can send a message to your representative in the House This comes from Americans for Contraception and Chopwood Carry Water on Substack. All you have to do is on your cell phone, send a text message. Here's the message. It goes to 50409, and the message is sign, SIGN, space, PZUMHX. Sign, PZUMHX. I'll read you what you're going to send. The majority of Americans believe that birth control should be legal and accessible. I was shocked to learn that the House Appropriation Committee has approved a plan to eliminate funding for Title X, a program that millions of Americans rely on for family planning services. Without Title X, more than 2 million Americans, most of whom are below the poverty line, will be left without their primary source of birth control and reproductive health care services, such as cancer screening and sexually transmitted infection testing. This will lead to more unintended pregnancies and even deeper economic disparities in our country. I urge you urgently to vote against this bill and protect Title X. I'm going to be watching this vote closely. Access to contraception and reproductive health in general is a top issue for me. Thank you. That's what I've got for you. Down below, you can like, share, and subscribe. Send me questions or comments in the comment box or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.